February 11th, 2003. Everything progressed normally. Pregnancy was normal. She developed normally. When she was 16 months old, she was not walking. We knew that there was something wrong. We took her in. She also has juvenile rheumatoid arthritis, so we took her in. She had surgery for that. She had both knees scoped. Still wasn't walking. I blamed it on, it was the JRA. She wasn't walking because of her knees. But I still knew something wasn't quite right. So Dusty and I finally, decided we were hurting our child by not admitting that there was a problem, so we took her in. She was first diagnosed with autism, as a lot of the Rett girls are. There's a misdiagnosis. We brought her in for testing, came to the school, and they diagnosed her. We got her into the program. She was in pre-K here at Bremont for 2.5 years, started when she was 3. Dr. Knight, who worked with Robertson County Special Services at the time, called a special meeting for Dusty and I one day and said she didn't feel that it was autism. She thought that was a misdiagnosis, and she thought it was this thing called Rett syndrome. I had never heard of Rett syndrome at that time, so she gave us her research that she had done, sent us to a doctor in Houston. As we researched more, we pretty much felt that that was a correct diagnosis. We went and met with him, and he did all the testing. She couldn't do most of the things he asked her to do, pick a block up, stack it, put it in a cup. We knew at that point there was obviously something wrong. He was going to have us come back a week or so later. Dusty just asked him point blank, as he usually does, to just tell us, look, we're 3 hours away, just tell us. And he said, okay, I can tell you right now, she's got Rett syndrome. From then on, we just went through, trying to cope with the diagnosis, trying to get her, through school, bringing her through the process. But everything up until about 16 months was normal, and that's the way the Rett girls are. They develop normally, and then they regress. We started the trial in May of 2013. There was a phase 1 and a phase 2. We actually applied for phase 1. We didn't get in. There were some doctors transferring and things that happened there, and they started phase 2, and a little bit of a misconception. We thought our paperwork was still in the system. They said, no, you need to reapply, so we filled everything out. Literally within 24 hours of filling out the paperwork, they called us and said, we have you scheduled for a pre-screening. We were on a plane less than a week later going to Boston. We weren't sure at that point if Marnie was going to get in because of her age. With it being a growth hormone, they weren't sure with her being an older child with puberty and the growth hormone. So we came home really kind of disappointed. We didn't feel like it was going to work. About a week later, they called us and said they felt everything was okay. Her bone age x-ray said that she was fine. She got into the program. So 2 weeks later, we were back and we started. It is IGF-1, it's a growth hormone, and she received injections twice a day, every day for 20 weeks. The hope is that the IGF-1 will not cure Rett syndrome, but reverse some of the symptoms. Some of the things that they've seen, some girls have spoke words, some girls have been able to feed themselves, some just help with attention span, just hand function. So we did that for 20 weeks. There was a little bit of a delay in the process, so it took a little bit longer. We were off medication for 26 weeks. We started again and we're back on for 20 weeks. And the way the trial worked was you received placebo for 20 weeks, medicine for 20 weeks, but you didn't know at which point, but you did get medication at some point. Dusty and I firmly believe that she was on the medication the second half of the trial. We saw her attention span improve. We saw her hand function get a lot better. She was able to pick up her sippy cup, take a drink herself, set it back down without flinging it, without losing control. And she really, if you know anything about her, if you've seen her before, she would sit there, but she might be, looking all over the place. now she really looks like she's with us. You know, she's there, she's listening to you, she's looking at you. And I really think, you know, we didn't get huge improvements, but those are things that, you know, just being able to give herself a drink is a huge thing. Last November we called the Toby rep to come down and demo a Toby. The Toby is an eye gaze technology device. It tracks the girl's requests by eye gaze. So Marnie looks into the Toby, she locks on to one of the selections on the screen. There's a little red circle that goes around that tracks her eye gaze, and that makes her selection. It has voice output, so whatever she looks at, it tells her that that's what it is.
If and when they find a cure, what are you looking forward to most?
To hearing her say that she loves me.